Insulin is a life-saving medicine used to control blood sugar levels in people with diabetes. It helps the body move glucose from the bloodstream into the cells where it is used for energy. Using insulin safely is extremely important because incorrect use can lead to serious problems such as low blood sugar, hypoglycemia, or high blood sugar, hyperglycemia. Every person prescribed insulin should understand the type they are using, how much to take, and when to take it. Safe insulin use begins with proper education, regular monitoring, and following medical advice carefully to maintain stable glucose levels and overall health. Before using insulin, always wash your hands thoroughly with soap and water. Clean hands reduce the risk of infection when injecting. Check the insulin label carefully to make sure you are using the correct type and dose. Insulin comes in different forms such as rapid-acting, short-acting, intermediate-acting, and long-acting. Using the wrong type can disrupt blood sugar control. Also, check the expiration date and examine the insulin. It should look clear or evenly cloudy depending on the type. If you see clumps, discoloration, or particles in clear insulin, do not use it and replace the vial or pen. Proper storage of insulin is essential for safety and effectiveness. Unopened insulin should be stored in a refrigerator but never in the freezer. Freezing destroys insulin, making it useless. Once opened, most insulin vials or pens can be kept at room temperature for a limited time, usually 28 days, but always follow label instructions. Avoid exposing insulin to heat, sunlight, or extreme cold, as temperature changes reduce its strength. If insulin has been left in a hot car or near a heater, it may no longer work properly. Safe storage ensures the medicine performs correctly in controlling blood glucose. Always use the correct injection technique when administering insulin. Choose an injection site such as the abdomen, thigh, upper arm, or buttocks. The abdomen is often preferred because insulin absorbs consistently there. Clean the skin with an alcohol swab and let it dry before injecting. Pinch the skin gently, insert the needle at the correct angle, and inject the insulin slowly. After injecting, hold the needle in place for a few seconds to ensure the full dose enters. Remove the needle carefully and avoid rubbing the area, as this can affect absorption speed. Rotating injection sites is an important safety practice. Repeatedly injecting in the same spot can cause lumps or thickened skin called lipohypertrophy. This condition can make insulin absorption unpredictable, leading to unstable blood sugar levels. Rotate within one area, such as different spots on the abdomen, instead of switching randomly between body parts. Keep injections at least 1 inch apart from previous sites. Proper rotation prevents skin damage, reduces pain, and improves insulin effectiveness. Check your skin regularly for any swelling, bruising, or hard areas and inform your healthcare provider if you notice unusual changes. Using the correct dose of insulin is critical. Never change your dose without consulting your healthcare provider. Insulin needs vary based on meals, physical activity, illness, stress, and other factors. Taking too much insulin can cause hypoglycemia, while too little can lead to hyperglycemia. Use a measuring device, pen, or syringe accurately and double-check the dose before injecting. If you are unsure whether you took a dose, do not guess. Monitor your blood sugar and seek advice instead. Keeping a daily log of doses and glucose readings helps ensure safe and effective insulin management. Monitoring blood sugar regularly is essential for safe insulin use. Use a glucometer or continuous glucose monitor, CGM, as advised. Check levels before meals, after meals, at bedtime, or whenever you feel unwell. Tracking patterns helps you and your doctor adjust insulin safely. High readings may signal the need for more insulin, while low readings indicate too much insulin or missed meals. Never ignore symptoms like dizziness, sweating, confusion, or shakiness, as these may indicate low blood sugar. Frequent monitoring helps prevent emergencies and ensures insulin therapy is working properly. Recognizing and treating low blood sugar quickly is vital. Hypoglycemia can happen if you take too much insulin, skip meals, or exercise heavily. Symptoms include sweating, trembling, hunger, headache, confusion, and rapid heartbeat. If untreated, it can lead to seizures or unconsciousness. Follow the 15-15 rule. Consume 15 grams of fast-acting carbohydrates such as glucose tablets, fruit juice, or regular soda, then recheck blood sugar after 15 minutes. Repeat if necessary. Always carry a source of sugar with you. Family and friends should know how to help in case of severe hypoglycemia. High blood sugar, or hyperglycemia, can also be dangerous. It may occur if you miss insulin doses, eat too many carbohydrates, or are sick. Symptoms include frequent urination, extreme thirst, fatigue, blurred vision, and dry mouth. If blood sugar remains high, it can lead to diabetic ketoacidosis, DKA, a serious condition. Check your glucose levels regularly and follow your correction dose plan if prescribed. Drink water to stay hydrated and seek medical help if levels remain high or if you experience nausea, vomiting, or difficulty breathing. Proper insulin use prevents these dangerous complications. Meal planning plays a major role in insulin safety. Insulin doses often depend on carbohydrate intake. Eating regular meals and balanced portions helps prevent sudden blood sugar changes. Avoid skipping meals after taking insulin, as this increases hypoglycemia risk. Learn to count carbohydrates accurately if using mealtime insulin. Include healthy foods like vegetables, whole grains, lean proteins, and healthy fats. Limit sugary snacks and drinks. Consistent meal timing allows insulin to work as expected. A dietitian can help design a plan that matches your insulin schedule and supports long-term diabetes control. Physical activity affects how insulin works. Exercise lowers blood sugar because muscles use more glucose for energy. This can increase the risk of hypoglycemia, especially if insulin was recently taken. Check blood sugar before exercising. If levels are low, eat a snack first. Carry fast-acting carbohydrates during workouts. You may need to reduce insulin doses before prolonged activity, but only with medical guidance. After exercise, monitor levels again because delayed hypoglycemia can occur. Regular activity improves insulin sensitivity and overall health but must be balanced carefully with insulin dosing. Illness can change your insulin needs. When sick, the body releases stress hormones that raise blood sugar levels, even if you are not eating much. Never stop insulin completely during illness unless directed by a doctor. Check blood sugar more frequently and test for ketones if levels are high. Drink fluids to stay hydrated. You may need extra insulin temporarily. Seek medical care if you cannot keep fluids down, have persistent high readings, or show signs of ketoacidosis. Having a sick day plan, prepared in advance, improves safety and reduces complications. Using insulin pens and syringes correctly prevents dosing errors. Always use a new needle for each injection. Reusing needles increases pain, infection risk, and inaccurate dosing. Remove air bubbles from syringes before injecting. With insulin pens, prime the pen to ensure insulin flows properly. Dispose of used needles in a sharps container, never in regular trash. Proper needle handling protects you and others from injury. Safe equipment use is just as important as correct insulin dosing in maintaining effective diabetes care and preventing avoidable health risks. Alcohol consumption requires caution when using insulin. Alcohol can lower blood sugar hours after drinking, increasing hypoglycemia risk. Always eat food when drinking alcohol and monitor blood sugar closely. Limit intake and avoid drinking on an empty stomach. Symptoms of low blood sugar can be mistaken for alcohol intoxication, which is dangerous. Inform friends or family about your diabetes so they can recognize signs of hypoglycemia. If unsure about safe alcohol limits, discuss with your healthcare provider. Responsible habits reduce unexpected blood sugar drops linked to alcohol use. Traveling with insulin requires preparation. Carry insulin, needles, and monitoring supplies in your hand luggage, not checked bags, to avoid temperature damage. Bring extra supplies in case of delays. Keep insulin in an insulated pouch when traveling in hot climates. Time zone changes may affect injection schedules, so consult your doctor beforehand. Always carry a prescription or medical letter for airport security. Wear medical identification indicating you use insulin. Planning ahead ensures uninterrupted insulin therapy and protects against emergencies while away from home. Education and regular follow-ups with healthcare professionals are key to safe insulin use. Attend diabetes education programs to learn injection techniques, dose adjustments, and problem-solving skills. Regular doctor visits help monitor A1C levels, kidney function, and overall health. Share your glucose records and discuss challenges. Early detection of issues allows quick corrections. Never hesitate to ask questions if you are confused about instructions. Knowledge empowers you to use insulin confidently and safely while reducing the risk of long-term complications related to diabetes. Emotional health also affects insulin safety. Stress, anxiety, and depression can interfere with self-care routines, leading to missed doses or poor monitoring. Stress hormones may also raise blood sugar levels. Develop coping strategies such as exercise, relaxation techniques, or speaking with a counselor. Support from family, friends, or diabetes groups can improve motivation. Taking care of mental health helps maintain consistent insulin habits. A balanced emotional state supports better glucose control and overall well-being, making diabetes management safer and more effective. In conclusion, safe insulin use requires careful attention to storage, dosing, injection technique, monitoring, diet, and lifestyle habits. Understanding warning signs of low and high blood sugar helps prevent emergencies. Planning for exercise, illness, travel, and daily routines ensures insulin works effectively. Never make major changes without medical advice. With proper education and consistent self-care, insulin therapy becomes a powerful tool for living a healthy life with diabetes. Staying informed, prepared, and proactive makes insulin treatment safer, more effective, and easier to manage every day.